Hello, everybody, and welcome to episode 11 of the Cycle Podcast. Thank you so much for being here with me today. I talk with Larry and Belinda Wurn, and they have a physical therapy center called Passage Physical Therapy, and they have actually come up with some very interesting research and treatment for endometriosis without surgery. It was a wonderful conversation. I really hope you enjoy it. Very interesting to me. And I'm very interested actually to maybe potentially go check out this method to avoid having another surgery. So I hope you enjoyed this episode. And as always, I'm so grateful that you're here. Thank you so much for listening. I can't believe we're on episode 11. I'm so excited. Maybe next year we'll be able to do 2 a month, but the interest has been there. And I really am just very grateful to you all for listening. Anyway, I will stop blabbing. On with the episode. I hope you enjoy it. Hope you're feeling well. Take care. Hello, everybody. I'm super excited to talk to Larry and Belinda today from Clear Passage Physical Therapy and Physiotherapy. They have done a ton of research on endometriosis and some other things that affect women with endometriosis. We are going to chat with them today, and they are both here. So hello and welcome.
Hi, thanks for having us.
Oh, we're so excited to have you today, both of you. Thank you so much for taking the time. Sure. Why don't you guys tell us just a little bit about Clear Passage and what you guys do so the listeners kind of know where you're coming from?
Okay. We started, good grief, it's been 30 years ago when I was we weren't really at the time thinking about endometriosis at all. We were just thinking because she had radiation therapy and surgery for cancer. As we started developing work, and it took about 2 years of continuing ed in the U.S. and in medical schools in Europe to develop work that would help free up her adhesions. She, summa cum laude physical therapist, said, well, you know, Larry, there are a lot of people out there with adhesions. I don't want to do this hot packs and ultrasound physical therapy anymore. I want to treat these people that really need it. We, at the time, honestly, Melissa, knew nothing about endometriosis. We were treating people with adhesions, and adhesions go with endometriosis kind of like salt goes with pepper or bread goes with butter here in the U.S., but they're frequently found next to each other. And we were treating patients having periods, and it's remarkable. You've treated me, and I had no pain, you know, because I have endometriosis. And the first one said that, and we went, oh, okay, good. And the woman left, and Belinda and I turned to each other and said, what's endometriosis?
How many years ago was that?
That was
1990.
Wow.
91, a long time ago.
Yeah.
I mean, you know, we started treating adhesions, which is internal scar tissue that forms as a natural part of the healing process after anyone has surgery or trauma, like car accidents or bad falls, or infection or inflammatory conditions like endo. The adhesions form, you know, the endometrial implants, the body sees those as foreign. So it lays down adhesions trying to protect the body from those endometrial implants. So, you know, we learned how to do the work that we do. Like Larry said, I developed cervical cancer that by the time they found it, it had spread toward my rectum. So they were scared to do a hysterectomy. So they were very aggressive with me with external and internal radiation. So we started out treating people with complex chronic pain. And, you know, then we started hearing, you know, feedback back from patients who had endo. And, it got, you know, after our treatment, they didn't even know their period was coming. It was pretty remarkable. We were very surprised.
So then the next thing that happened was the head of the Endometriosis Association called us, and she said, I'm hearing about the work that you're doing, and it's pretty neat. We've not heard of this before. She joined our board of advisors, and then us to a conference of endometriosis experts from around the world. It was, I remember Belinda and I were in a room of about 400 physicians, and there were some drug company representatives there too, because endo, if you take something that stops your period and stops the swelling, it seems to decrease the pain. So we were still kind of new at all this treating endometriosis, although we were having great results. So I stood up and I said, is there consensus among this august group of physicians of where the pain comes from with endometriosis? Melissa, there was total silence in the room.
I believe it.
And then finally, Alice Domar turned to me. She's a PhD from Harvard. And she said, Larry, we just don't know where the endometriosis pain comes.
So I was saying in the early 90s, I feel like women didn't even know what endometriosis was. Were they just coming to you with pelvic pain and you knew what it was? Or how did you even know that these women had endo, or did they know?
You're right. They came to us with pelvic pain, severe pain with intercourse, severe period and ovulatory pain. And so we were treating the adhesions, and, we do a very thorough initial evaluation the first time we see someone. And, all of them, so many of the women that had the pelvic pain and pain with intercourse said they had endometriosis. So, like Larry said a few minutes ago, we looked at each other and we're like, what's endometriosis? So we had started doing some research studies with a research gynecologist. And so, we learned from him about endometriosis. And, then once we had published a few studies showing that, our work was very effective at reducing the pain with periods, the pain with intercourse, we started having more women coming to us specifically, with a diagnosis of endo-related pelvic pain.
Wow, that is really, really interesting. And yeah, I'd love to hear, how do you treat it, or what do you do? Because as someone you're talking to on the phone right now who's had 6 surgeries,
Oh,
wow. I'm just curious, like, could I have went a different route?
Yeah. Let me talk for a moment about the surgeries, and then we'll talk about what we're doing. What happened with us was we started opening blocked fallopian tubes. We had no idea or no intention of opening blocked fallopian tubes, and they kept opening, and women were becoming pregnant. The chief of staff of the hospital, the head of the hospital, called us in. He said, Mr. Wurn, I'm a gynecologist surgeon and a research gynecologist. What in the world is this about these claims of opening blocked fallopian tubes? We showed him a half a dozen charts, and he said, Mr. Wurn, I'm a very good surgeon. You're doing things with your hands I don't think I could do surgically. Are you doing any research on this? And I said, no. Would you like to? Sure, I'd love to. Don't know how. Mr. Wurn, I'll be your research director, and I won't charge you anything. He's been with us. He left the hospital eventually and just stayed with us. Never charged me a cent. And he just said, I think this is so important. So that's when we learned that, as we started examining, as Belinda was talking about, looking at patient histories, the treatments for endometriosis were generally either medications that stop your period totally, which is okay if you don't mind that, but if you're trying to get pregnant, that's not good, or surgery. Well, the problem with surgery is no matter how brilliant and compassionate and wonderful a surgeon is, surgeries cause more adhesions. They just can't help it. It's how the body heals. It's the first step in healing, is these tiny strands of collagen, like the strands of a nylon rope. They're very strong. They're about 2,000 pounds a square inch, which is about 140 kilos per square centimeter. They come rushing in, and they start laying down wherever the surgery has been, or wherever the endometriosis is, even for a woman who has not had surgery. So when that happens, we figured out that as these endometrial implants swell every month, they pull on these little strands, And that's where the pain comes from. Because when it was just pulling on the organs.
Yeah.
So because when we were treating, our focus was detaching these little strands from the organs. And when we did, Melissa, these endometrial implants would they could stretch and grow and shrink back down again, but they would not cause pain, or the pain was significantly reduced. So in all of our studies, the success rates are published in peer-reviewed journals, and so they're out there, but they're very big numbers. And among other things we found that was surprising. Do you want to tell the story about the woman that came in?
Well, yeah, we treated this one woman. Again, this is like in the early 90s. And God, I can't remember her history. I'm sure she had several surgeries. I'm not sure exactly what for, but she had endometriosis and she had very severe pain with intercourse. And so we treated her. And she
about 45 years old by this time.
Yeah, she's about mid 40s. And she called, I don't know, I guess a couple of weeks after treatment. And she said, Belinda, I felt like I just had to call you. I don't know what kind of feedback you get from patients, or if you've heard of any unusual, if you want to call it, side effects or benefits from the therapy. But I had just amazing things are different. And I said, well, you want to tell me what those are? And she said, well, it's a little embarrassing. And I said, well, what is said here stays here. We're not going to ever, mention your name. And she said, well, before I came to you, I had really bad pain with intercourse, in no matter what position they were in. And she really hadn't ever had an orgasm, because as soon as it would start, she would have so much pain, she'd have to stop the intercourse. So I said, and so how is it different now? And she said, I am having orgasms like I've never had before.
And it doesn't hurt.
And it doesn't hurt. And I said, well, is that okay? She says, oh gosh, yes. My husband thanks you. I thank you. It was very funny.
Well, and it's just crazy that women who suffer from that much pain, they just don't know any better until it's gone too.
You're right. Exactly. They assume it's like that for everybody.
Yeah.
So after about 6 or 8, what to do about it, and I said, look, Belinda, don't even mention it. We're already the weird practitioners in town. just keep it to yourself. Well, the chief of staff finds out about it, and he says, oh my gosh. He said, we have to look at this, and we need to publish on this if this data holds true for a larger number of women. And I said, we do? He said, oh yeah, we can measure the 6 domains of sexual function. And we did, and we published and presented at this huge physician conference, improved desire, arousal, lubrication, orgasm, satisfaction, and pain. Significantly in all 6 of those domains. So we realized, these little things must form wherever tissue is. These little adhesions, they may be microscopic. They must form wherever we have tissue trauma, as Belinda said, when there's been endo or just any surgery.
Car accident. If any women have had bad falls and landed on their tailbone or their buttocks, adhesions form in the pelvic floor and can attach to the cervix. And if the cervix can't move during intercourse, which it's supposed to be able to do, that hurts.
So coming back to your question, Melissa, about the surgeries, I mean, really, I'll tell you, we were at that same conference of endo experts from around the world. So surgeons think a little bit differently, and some are very conservative and some are not. I was with the head of the Endometriosis Association, and this physician came up to us and he said, Dr. Bolweg, he said, I've finally figured out how to cure endometriosis. And we both turned to him, and she said, oh, really? He said, yes. He said, I've realized if I cut so deeply into an organ that I get to the very bottom of it, that endometriosis will be gone.
My goodness.
So, they can be a little myopic. This
Yeah.
fellow was. a little bit more aggressive than you might like. So, but of course, he's well intentioned. He's trying to help these women.
Well,
But
for sure, for sure. I mean, there's so many surgeons that do the wrong surgery. They do ablation surgery, which just causes what I'm assuming is more adhesions because they're just,
Absolutely.
burning that superficial layer off. So,
Yeah, you're right. I mean, that's any kind of tissue trauma, whether it's from surgery or trauma or endo. The body lays down adhesions as a normal part of the healing process. And you say you've had 6 surgeries. Each surgery, like Larry said, doesn't matter how great the surgeon is and how skilled, but that first surgery, you want the incision to close, and it's the adhesions that do that, but they form sort of like a spider web.
right.
So they can do start sticking to other organs and other tissues. So each successive surgery, they go in again, cut you open again, cut out more adhesions, but again, they're creating new ones.
Right.
So it becomes a snowballing issue.
No, it's full circle because I do know women who've had the best surgery, like you've said, but still, unfortunately, a lot of them feel better, which is great, but some of them don't. And I'm sure it's adhesions. And someone like me, I had 40 endo lesions removed in my last surgery.
Oh, wow.
So you can only imagine if there's an adhesion on each one of those, my pelvis isn't even big enough to hold all of that.
Yeah.
Right.
Well, you probably have, like what I developed from the radiation, radiation is basically burning. If you've ever seen a badly burned patient.
Yeah.
And so I developed what's called a frozen pelvis.
Yes.
Where everything was glued together. So I suspect you might have something like that.
Yeah.
And I mean, that's what prompted us to try to figure out how to get me out of pain. I couldn't work for about 3 years after my radiation. I mean, it killed the cancer, and I'm still here at 68, but basically destroyed my ovarian function and threw me into menopause at 33. And I couldn't work for about 3 years. I had intestinal problems, pain with sitting, pain with intercourse, sacrococcygeal pain. And I went to, 6, 7, maybe even 8 specialists. And I got really tired of hearing it's all in your head or you have to learn to live with it. And at 33, that was not acceptable.
Right. And women with endometriosis and all of them that are listening to this podcast, they've all been told that same thing. It's in your head, you're making it up, or they get the wrong treatment from their doctors because the doctors just aren't well educated on the disease. So very, very similar and unfortunate. And especially, at 33 to hear that. I mean, I know 18, 19, 20-year-olds that are in debilitating pain every day and trying to find an answer. So I'm just can't wait to hear more from you guys. And this is very interesting. This is the first time I'm hearing of this, and someone who's in the endometriosis kind of world, which I am for 20 years. I'm really excited to hear more about what you have to say and how potentially women like me can get help without having another surgery.
Well, we felt it was important to conduct clinical research because it's easy to say, oh, I bet I can help that. But unless you can quantify it and have physicians and PhDs that look at that, design the studies and measure your results and publish them, you're buying what we call a cat in a sack. You don't know what you're getting.
Sure. So
we had this gentleman who came to us from the National Institutes of Health up near Washington, D.C. here in the U.S. And we have clinics in England, and we do see people from Australia as well, but largely from the U.S. But this researcher came from the National Institutes of Health. He heard about us from his son, who was a physician, who kept seeing these films of ours that were women, we were opening their blocked fallopian tubes. And he said, Dad, you need to study these people. The guy moved down to Florida where our main office is and started studying us. And I said, Dr. Wickman, how many hours does it take for us to open blocked fallopian tubes, for example? And he said, well, he looked at it and he said, he measured dozens of our cases, and he said it's 16.2 hours. So we designed a 20-hour program, and that's what all of our published literature is based on, where women fly in usually on the weekend. We'll start on Monday morning. They'll get 4 hours of therapy, 2 hours in the morning and 2 in the afternoon. Monday, Tuesday, Wednesday, Thursday, and Friday, and then they fly home on Friday.
No, Saturday.
So on Saturday, sorry, or Friday afternoon. So our program has developed along those lines based on literature and published literature and data from the biostatisticians and the PhDs and the doctors and the chief of staff at the hospital, that a 20-hour program has been effective for people women with endometriosis. There's some of our simpler cases now, as we're seeing patients that have been, I saw this kid who was run over by a school bus and split his pelvis open like a book. I mean, it would just see these very serious cases a lot. But anyway, it's a 20-hour program, generally Monday through Friday. If you happen to live in one of the cities where we do have a location, you can space out treatment a little bit.
Okay, and so tell us about the treatment. What do you do to help?
Well, the first hour and a half is a very thorough initial evaluation. As a matter of fact, the first several hours before we even accept a woman as a patient, we're going through her medical history. We may be asking her for additional information or asking for information from her physician, because we want to accept the people that we think we can help and don't want to accept anybody that we think there would be a problem for them. So then, assuming we accept the patient, she comes in, hour and a half initial evaluation. And then we look at her history. We see, has she had surgeries? Where has she had surgeries? Where's the endo? Where's the pain? We start palpating her and feel if she's lying down, generally on her back, maybe with her knees up on a pillow, so we can sink in a little bit easier. We start palpating and feeling. And Melissa, it feels like, sometimes it'll feel like a ball, or the whole abdomen and pelvis is hard. Sometimes, as the more that we're palpating in there, parts begin to relax as some muscles are relaxed. And then in some areas it doesn't relax and it's still hard. We start to develop a geography of where the adhesions have formed in this patient's body. And we'll get onto a place and we'll hit a place. And that during that first hour of treatment, where we'll say, do you notice that? And the patient will say, yeah, that's the place I've been telling my doctor about for 15 years that he tells me doesn't exist.
Right.
So, one thing I'd like to mention is adhesions are made up of soft tissue. So they do not show up in any kind of radiologic diagnostic tests. So they don't show up on CTs, MRIs, X-rays, ultrasounds. So we use our hands. Our treatment is all hands-on. What we're doing is not massage. We don't use lotion. We need to have friction and put the adhered areas on a stretch. And, we just slowly keep working on areas until the tissues start to soften and relax and let go.
It feels like to us like peeling out the run in a three-dimensional sweater. It's really pretty extraordinary.
And so is the tissue getting broken up? Is that why people start to feel better and almost get looser, or does it go away, or where does it go? What happens to it? We have not treated anyone under laparoscopy, because anybody we've suggested that to said, well, why would I get a surgery if I'm going to see you? Right.
So, but we know there are two elements to adhesions. One are these tiny strands that are very powerful. As I said, they're like 2,000 pounds a square inch, or 140 kilos per square centimeter. But where each of them, so you get endometriosis or you get some inflammation, these strands come rushing in and start laying down on each other in a random pattern to help surround the area that's been injured or that's been cut, or where the endometriosis is creating inflammation. The other part of that adhesion is the molecular chemical bond that attaches each of those strands to the next one and the next one, and then finally the underlying structure, the underlying pain sensitive organ. So as we're treating, we believe that we are not breaking these 2,000 pound a square inch strands, but we are detaching each one from the next one and the next one and the next one. And that's really what it feels like. It feels like pulling out the run in a sweater. Because every cell in the human body is covered with collagen strands, as these detach, it makes sense that they detach at one end or the other, and then that strand can lay down on the cell that it's still attached to, but it's not attached to the next one and the next one and the next one. So they don't break apart and go throughout the body from everything that we've found. They just detach, kind of like, well, when you pull out the run in a sweater, those strands don't go anywhere, but the run disappears.
Right.
So it's that's the analogy I can use, if that makes sense for you.
Yeah, it's like we're slowly peeling things apart that are stuck together that shouldn't be. And as the tissues and organs can move more freely, symptoms start to get better and the pain starts to decrease.
Understood. Okay, that makes a lot of sense, and it's very interesting to me. I'm sure our listeners are very wowed by this, and I think it's, just such a different concept, but it makes sense to me, in a rational way that makes sense, right? Everything's, I've been opened by a surgeon who didn't know endometriosis and just said, everything's stuck together, so
Right.
I understand how that would cause pain.
Yeah.
So
yeah, if you could picture your body being like knit like a sweater, and everywhere you've been cut or wherever the endometrial implants are, it's as if you've got many different runs in that three-dimensional sweater.
Right. And so one of my surgeries, my last surgery, was with a specialist, but I did have a bowel obstruction, and I did see that you've also treated bowel obstruction. So a lot of women with endo
Yes.
have that issue too, because what we're talking about with the adhesions, it was either from the endo or the adhesions or whatever it was, but they said that my bowel looked like a balloon animal. It was strangled.
Yeah.
And,
Right.
and that makes sense. It sounds like exactly what you're talking about with the run and the sweater. Is that something that you could also potentially work out without having surgery?
Oh, absolutely. That's probably about 30% of our patients. And again, we learned about treating bowel obstructions through me again. 20 years after my radiation, 6 months apart, I developed 2 total bowel obstructions. So I've had the last 3 feet of my small intestine cut out.
So here's some history on that. When Belinda had her radiation therapy, we treated her pelvis, and we spent all this time treating below her umbilicus, below her what's called belly button. So we weren't really thinking of the fact that this radiation therapy was going all the way up into where her liver and her intestines and pancreas and all that was. So we didn't treat up there, and so those adhesions did develop there and eventually caused a bowel obstruction. What we've learned is that adhesions can form anywhere in the body.
Mm-hmm.
So where we first started treating her for pelvic pain and intercourse pain, really in the most intimate parts of her body and her vagina and such, then people started reporting decreased pain with endo and with intercourse, but also we started opening blocked fallopian tubes, which we really weren't intending to do, but these little structures were being closed by adhesions. Well, it made a really good science project because we could get a yes/no answer as to whether or not we had helped these women with blocked fallopian tubes. And 69% of them who come to us with total tubal occlusion, both tubes blocked or one removed and the other blocked, we cleared the tubes in 69% if they've never had a surgery on the tube. If they've had surgery on the tube, it's about half of that, about 35%. Then about 12 years ago, this rock and roll singer calls us up and said, well, I saw some of your studies where you clear open blocked fallopian tubes. Can you open bigger tubes? And I said, what do you mean? She says, well, I've had 7 surgeries in the last 30 months for bowel obstruction and for adhesions, for breaking of adhesions. They've scheduled my 8th surgery now. My last surgery was 12 weeks ago. They've scheduled my 8th surgery. They're going to cut out half of my stomach and my gallbladder, everything that adhesions can adhere to. Can you help that? And we said, well, you can't promise anything, but it sounds like the same stuff. So she came in. That was 12 years ago. She has come back to us twice, but she was very adhered. And she canceled her surgery and she hasn't had a surgery since. So we just published with a surgeon from Harvard who has now moved to Stanford. She taught surgery at Harvard for 20 years. And another surgeon from Washington University in St. Louis just published a study of treating people who have recurring bowel obstructions. And hopefully that won't happen for you. But when you have a surgery, it creates these adhesions like straitjackets in the body that come back often and will strangle the bowel again. And so we had a controlled study, a phase 2 study, which is over 100 patients in each group. The group we didn't treat that was having recurring obstructions was much easier than the ones we did treat. They had about half the number of surgeries and half the length of time of surgeries. They had 15% of them had another total bowel obstruction within 90 days. The group that we did treat, less than 1% did. So it's
Wow.
0.97. So it's been, Melissa, it's been like inventing a new field of medicine, you know. I'm 71. I'd like to retire, but I'm just too excited.
Well, and there's
helping all these people.
There's so much more awareness about endometriosis now too. I would say in the past 5 years, it's really what I would say is exploded the awareness, which is very exciting for me. But going back to, you know, if I'm coming to see you for 20 hours on that Monday through Friday, everything you're doing is you're just working through to break these or to make these adhesions not be attached. And that's it. You're just using your hands. Is there anything else you're doing? Just if women are considering coming to see you or just want to understand, a lot of these women are in pain. And so they're afraid, you know?
Yes. Our treatment is just the hands-on and
no drugs or surgery.
No drugs, no surgery. And an important piece to our success rate, what we've found through, you know, some patients who have come back for some more treatment, we've developed a home program of stretches that we feel help maintain the improvements that you gain with our treatment. We teach you self-treatment techniques using your own hands or different tools that we have, plastic tools that have different size round knobs. And, you know, we really empower people and you know, we want you to know enough things to do to yourself, you know, that you can maintain the improvements that you gain from our treatment. So It doesn't have to be real time consuming, you know, approximately 20 minutes a day while watching TV or when you get in bed, and you'll know enough things to do to yourself that you should be able to hopefully maintain the improvements from treatment.
And then my other question is, and that makes sense. And I think that that's wonderful. And 20 minutes a day is worth it versus, you know, another surgery. But a lot of women that I know too, from the surgeries or from endo lesions sitting on nerves or the sciatic nerve, or I don't know if you've seen patients like that have issues with their bladder. They actually can't hold their bladder because they may have, you know, a lesion or adhesions or something hitting those nerves. Can you also help with that?
Yeah, absolutely. I mean, again, you have to picture the body like this 3-dimensional sweater, and the adhesions are they form like a spider web. So they can pull from scars in your pelvis or your abdomen. They can pull into your low back. They can pull down into the pelvic floor and squeeze like a straitjacket. So they absolutely can attach to nerves, causing sciatica, causing, you know, many different kinds of symptoms. They can also pull upward into the diaphragm, into the upper back and neck. You have to really think of the body very 3-dimensionally.
Yeah. And what's incredible, and actually when you say the diaphragm, I've met more women recently that have had lung collapses from endometriosis.
Really?
Yes.
Oh,
Yes.
wow.
So, I recently met a woman who had 7 lung collapses and
Oh.
until they figured out she had endometriosis. And then, so I would say it's more common than not because it must be those adhesions that we're talking about pulling down on the diaphragm. So on the first day of their period, their lungs are collapsing.
Wow.
Right.
Wow.
And when you I just wanted to clarify one thing too. The women, usually the people that come back for more are the ones that are severe, multi-surgeries, multi-bowel obstructions. Usually the endometriosis patients do not end up coming back to us.
That's true.
The other thing that kind of sparked from what you said is what we see is people come in and they've got back and neck pain because these adhesions in your pelvis are attaching from your pelvis and coming up to your ribs in front and kind of pulling you forward and bending you forward. It's kind of like the good student position, you know, when you've been bent over your school books for 12 years or 15 years or so, and it pulls you forward so you try to stand up straight, and as you try to stand up straight, it pulls more and causes more inflammation and more adhesions down there. So your back and neck start fighting, trying to get you to stand up straight, and you just can't because you have these powerful strands, really literally physical forces. Like, I mean, you could tie a boat to a dock with some of the ones that we felt. As we free those up, one of the first things that happens is people say, oh my gosh, I feel so much taller and I can breathe easier because they've been compressed, just what you described, but that's sort of physically and physiologically what we see happening with a lot of these women.
Yeah. And I mean, the adhesions absolutely can attach to the bladder. I mean, the bladder, you know, is right in front of the uterus. And, you know, if you picture like when you crimp a hose, it decreases how much water can flow through. It doesn't take much squeezing or twisting or pulling on any of the, you know, parts of the digestive tract or any of, you know, the bladder, any of the organs to cause symptoms from the adhesions.
Right. And one other question, just, I know you said you don't have a lot of repeat endometriosis patients unless they're very severe or have had a lot of surgery or bowel obstructions. Yeah, that was just another question. Have you had unsuccessful people? I mean, people who didn't feel that they like felt better afterwards, that maybe I have stage 4, right? So maybe a stage 1, stage 2, stage 3 that have 10 lesions versus someone who's had 40, 60, 80, 100. Have you had patients that were just like, you know what, I still not feeling better, and then they ended up having surgery?
We see so many women with stage 4 severe endo. And I mean, we've been able to at least significantly reduce the severity and the duration of their different pain and symptoms.
In a way, I think the more complex ones we see better results with, or more dramatic results with, because they're so adhered. It just freeing those things up is so much easier because all the adhesions are attached to other adhesions are attached to other adhesions. So as we start freeing it up, it starts freeing up throughout that entire lesion. I know when we were first opening blocked fallopian tubes, we were surprised that the women that were had one of the first ones, she was 41. She had only one fallopian tube. It had been blocked for 11 years, and she had stage 4 endometriosis. Doctors sent her to us for her endometriosis, and she was incredibly complex. We thought, well, she's only got one tube. It's been blocked for 11 or 12 years. She'll never get pregnant. Well, she comes in one day and she says, I don't know whether to hug you or hit you because I'm going to be 42 and I'm pregnant now. Whereas sometimes it would get a 23-year-old girl that would come in, she just had laparoscopy and has cleaned everything out. And as far as her fallopian tubes, there was kind of no adhesions to attach to the tubes for us to grasp onto. I don't mean to keep going back to the fallopian tubes, but we do see, in my experience, the ones that are more adhered are more the ones I love to treat because they get so much more dramatic results.
Right, for sure. Okay, well, good. Is there anything else you guys would like to add before, I let you plug where you are and how we can find you? And I already want to come see both of you. So I'm ready because it sounds amazing. But yeah, is there anything else you want to add or to the listeners?
We have clinics. We have some on the West Coast in California and in New York and St. Louis, and our home office is in Gainesville, Florida. We have 2 in England and London, and 1 in the Canterbury area in our country location. We did recently write a book and made it very inexpensive. I think it's 99 cents for Kindle, called Adhesions, The Body's Hidden Menace. So you can get a lot of information either by going to Amazon or Barnes and Noble, one of the booksellers, and looking for our last name, WURN, and look for that Adhesions book. Our website has about 500 pages with testimonials and explanations and such. It's really designed to educate so that when you read it, you go, oh yeah, this sounds like me, or yeah, that doesn't sound like me. So it's clearpassage.com. So our website is really the place to start, and there'll be some keys to kind of lead you through that, and to complete a medical history questionnaire. We review all of those very thoroughly, and we review them at no cost. And then we'll get in touch with you and we'll say yay or nay, or we have some questions. So
wonderful.
Do you have anything else to say, Belinda, on that?
Yeah, we're very thorough, like Larry said, in reviewing operative reports, any diagnostic tests. We want to make sure that someone doesn't have any contraindications that we wouldn't want to treat them. Like, we don't treat people if they have active cancer, if they have cysts that are really large, of a certain size. Endometriomas, the bloody cysts, have to be really small, because we wouldn't want to have the potential of possibly having a cyst rupture. So we want to make sure that the patient's going to have a really good outcome. I mean, our goal is to help you reach your goals.
Well, I think that's really wonderful. And thank you so much for all the information and your time. And really, thank you from the endo community for giving an alternative to surgery. I mean, I'm so grateful that we found each other and that I was able to talk to you both today, because this is a big eye opener for me. So I hope for our listeners it will be too. I really think, for anyone who's listening, it's clearpassage.com is the website, and they have locations in North America and the United Kingdom. So you can go check it out. And like you said, a woman could fly in for a week, get the treatment, and fly home.
Mm-hmm.
That's it. 5 days.
Okay.
One thing I wanted to mention is I got in a bad car accident in 2001. So while I was recuperating from that, I started writing a therapist training manual, because we had many physical therapists from all over contacting us and saying, I want to study with you. How do we learn what you do? So I started writing a therapist training manual. It turned into a 4-year OCD project. It's now about 550 pages. So we have a clinical internship training program. So, all of our locations, those therapists have studied the manual, and then they've come and had a very intensive several-week one-on-one training program. And, before we certify them, we make sure that our outline therapists are doing the techniques exactly the same as if you came to Gainesville. So, we're very particular about therapists that we even accept to go through our training program. So,
well, I think it's really wonderful what you two have done. And, again, from someone who, it sounds like, Belinda, you understand, but from someone who's been through a lot and been very sick, this is just very refreshing to hear. Yeah. So
wonderful. Yeah.
So I really appreciate it. I appreciate the time, and yeah, everyone thanks you for coming on and talking. And I hope you guys have a really great rest of your day here. And yeah, thank you.
Thank you so much for inviting us.
Yeah, thank you for the opportunity.
Oh my goodness. Thank you so much. And thank you for all the work that you're doing. Really appreciate it.
Oh, well, thank you so much.
All right. Take care.
Okay.
Yeah.
Bye-bye.
You too. Bye-bye.
Thank you so much for listening to this podcast, episode 11. I hope you enjoyed the conversation I had with Larry and Belinda. I found it very interesting, and I went and dug deeper into their website, and they have a lot of great data to back up what they're talking about. And I found it just so interesting that they started helping women with endometriosis when they weren't intending to, but they found that, by helping Belinda with her adhesions, that they were able to help women with endometriosis. If you want to check out more information about them, their website is clearpassage.com. Like I said, there's research on there. I found it very interesting. I am not sponsored or supported by them. I have not tried the method, but it is something I'm very interested in, because if this is a way to avoid surgery in the future, I think this could be a really great solution for women with endometriosis. So maybe I'll do it and report back and let you all know how it went. Thank you again for listening to this and for giving us a very high rating in Apple Podcasts. I cannot thank you enough. That means so much. If you enjoy this podcast and it brings you any value, if you rate us, it will help us just get more visibility. And I really cannot thank you enough for doing that and everyone's kind words. I started this almost a year ago because I wanted to raise awareness about endometriosis. As someone who's been suffering for over 20 years, I just don't want women to suffer as long as I have, and I wanted to empower them to let them know as much information as they could if it comes from someone's story, a doctor, or even research that I've done. I want to bring it to you here, and I'm hoping next year we can grow the podcast to a few episodes a month. I'm not going to commit to anything right now, but I would really like to do that. So thank you again for listening, and I hope you're feeling well. Take care.
The podcast you just heard was made using Anchor. Ever thought about making your own podcast? Anchor makes it really easy for anyone to get started. It's a one-stop shop for recording, hosting, and distributing podcasts. Best of all, it's 100% free. Sign up now at anchor.fm/new. That's anchor.fm/new to get started.